Good afternoon. I'm Nate Diskin from iMagnus Biomedical. Thank you. Let's see. We are a company that makes a product that's a fusion between an infusion pump and an infusion regulator. So an infusion pump will sit on an IV line in a hospital and actively pump the fluid down into the patient, whereas an IV regulator sits passively. Largely, they're mechanical devices, non-automated, and they regulate the flow but don't actually pump the fluid. We made a hybrid technology that bridges that gap. So what we have is an automated infusion regulator. So the problem with infusion regulators is that they require constant attention and they're highly inaccurate. So ours is more accurate than even an infusion pump, and it's about a tenth of the cost of the average human pump. So it fits in a nice situation in regulatory approval and compliance because it does not actively pump the fluid. We have made significant traction since graduating through the incubator program here. After this program, we went to Mass Challenge out of Boston, which is an international business plan competition with, I don't know, 2,400 companies, something like that. And so we were a finalist there. And following that, we set up a headquarters in New York, and we still have R&D down here in DC. And what we're doing is we're contracting the work out to different groups, so we don't have to become a big player ourselves. And we have currently struck a partnership with a California-based infusion technology company to enable our technology to both so by meter I mean measure the speed of the overall flow rate coming down from an IV bag to a patient, and also to regulate the concentration of a drug going into the line that leads to the patient. So as of right now, in the state of the art, there's nothing that does that. Nurses and other healthcare providers have to manually take calculations to determine the appropriate volume for a particular IV bag for that drug. The whole entire system's automated. We sell these packets that get pharmacy filled. They can also, down the line, we see them being filled by pharmaceutical companies. But so these packets get filled, the nurse or other healthcare provider will approach our system and pop them in like a cassette into a tape player. And based on wireless technology, the machine recognizes what drug it is, what concentration is appropriate, who the patient is. It all gets wired out wirelessly to our wireless platform, which can then be monitored on a phone, a nurse's station, or elsewhere. We're currently investigating some of the alternative markets, so we view our technology, that technology with the merging company, as a little too radical for this market. The big players in the infusion industry, like Baxter, Smiths Medical, they sell a product and it does perfectly fine, and so there's no need for hospitals to change at the moment. But the developing nations, the BRIC countries, BRIC and MIST, they have the ability now to go with the biggest and the best. And so we're targeting the countries that have the high-speed rail transit systems, in the same idea that America was the first to lay down the rail system, so we're the last to change. So we actually, as I'm talking now, we have an agent over in China putting feelers out in that market. We already have a couple of deals on the table. We are fully aware of the issues that come with dealing with some of the developing world, and that's why we've struck these strategic partnerships to protect our interests at a higher level. I suppose that's pretty much where the company is. Does anyone have any questions?
A lot of progress.
Yeah.
Anything new on your potential merger?
Yeah, so we're setting up a joint venture and a WOOFy. So a joint venture over in America, or here, and just a shell company over in China to hold our assets there. And we're going to be equal partners and allow the market to dictate our respective values to the company. Sure.
Consumer use insulin pumps for type 1 diabetics. Have you thought about making it?
Right. So we don't go down to volumes appropriate for insulin, but the partner company does. So in that aspect, we believe that we can ultimately make forays into that market. But as of right now, there are a lot of, that's really cutthroat at this point, the insulin pump market. And the particular niche the product fills is not so much a niche, it can be used everywhere. And so our system is actually modular. So you take a clip and you clip it onto a drip chamber, and as drops are flowing through that into the IV line, we're counting them. And it's a very robust system. And then that relays wirelessly with an actuator that's based on the line that can be mounted on the IV pole for security reasons. And that package there on the line has these cassette entry points. And so because there's almost 3 aspects of the technology, we are making the clip available separately. And so we believe that we can move a significant volume of parts of the system first as an easy entry point, as a foot in the door. So we can actually monitor flows off of established infusion pumps. And so it's not, if we go to a hospital and they say, well, we already have, this infusion pump, well, that doesn't mean that we can't be there as well. We can work off theirs, enable them to use our wireless platform and take advantage of the electronic medical records that our system keeps. And we have, printer-friendly versions and all that stuff. So you can actually pull it up and you can see a graph in real time, tell you, all the different medicines this particular patient has gotten and kind of how they're going. And you also get alerts on your phone if there's a problem with it, or at the nurse's station as well. So eliminating wires in the care setting was really important for us. So none of our devices have any wires. It's all battery operated.
Great. Nate, thank you again very much for coming
Thanks
in
very
and being
much.
with us today.
Thank you.
Good.
Thanks.
Good luck to you.